turn it over. Okay. Well, welcome everyone to the 27th Degree with Chris and Nancy from 27 Degrees Consulting. My name is Dr. Christopher Joncas, and I prefer the pronouns he and him. And today we're going to talk about understanding gender in the 21st century with my good friend Chris Medeiros. Before we get going, I just want to recognize our sponsor. We're always appreciative of Bay Coast Bank. Bay Coast Bank is just right for all of your financial needs. Visit baycoastbank.com or call 508-678-7641 to learn more. So Chris, tell the audience a little bit about yourself.
Hi, everybody out there in the virtual world. My name is Chris Medeiros. I'm a psychotherapist in private practice at a practice called The Meeting Point in Jamaica Plain, Massachusetts, a neighborhood of Boston. I am a native of Fall River. Chris and I have known each other forever. We went to high school together.
Very long time.
And most of my work is around the LGBTQIA community. So most of the clients I see are in that community.
All right, wait, I got to stop you. It used to be
Exactly.
LGBT, and now there's a bunch of letters added, so let's explain that.
You want to start there?
Yeah,
Okay,
let's
sure.
do that.
And I will also say, I can't guarantee you that more letters won't be added by the time I get to my car today. I think, and I'm being playful about it because I think it really is, we're at the infancy of understanding identity, gender, sexuality. And right now there's a lot of experimentation and things being thrown out there. So let me just go through it kind of, piecemeal, but the theory behind it we'll probably talk about as we're talking.
Sure.
So L is lesbian, G is gay, T is trans, B is bisexual, Q can stand for either queer or questioning, I is intersex, which is a term many people are not familiar with. The old term, which is not something people use anymore, but was called hermaphrodite, which means that these are people whose genital biology mixes male and female. So it's a physiological designation.
And that's in hermaphrodite's it's a little derogatory now.
Hermaphrodite would be kind of I think because it's clinical. Think the way that you wouldn't call your gay friend a homosexual because it just sounds very clinical. So it's the same thing. I think intersex people are saying intersex rather than hermaphrodite.
Okay.
And then A is asexual.
Asexual, okay. Meaning that there's no sexual desire or interest.
Right. People who define themselves as asexual would say that that sexuality is not a part of their life.
Okay, interesting. So talk to me a little bit. I mean, we talked about this before, why we thought this was an interesting and important topic to talk about. I can give you my perspective on it. Let me start with that. So, when we grew up, and we were in high school many, many years ago, understanding gender was not complicated, right?
Right.
You were born with what you had. You were male, you were female. You had male parts, you had female parts, and that was it. That's pretty much how it was. Mm-hmm. But things have gotten much more complex over the last number of years. Yep. And from my perspective, in medical school, we didn't really have any education in regards to a lot of this, right? I remember vividly that we did have a human sexuality course, which was interesting. There was this very secretive slide deck that this professor would bring in, and she would watch it like a hawk and guard it so it wouldn't be stolen. And it was these really old, black and white, probably 1960s era by the clothing, I would guess, slides on basically human sexuality, and, we delved into heterosexuality, homosexuality, and, et cetera, et cetera. You can imagine, right? A lot of giggles and all from the room,
Yep.
even though we were all adults. It's just,
Yep.
human nature. But that was it. That was really the extent of the education that we had. And then I think medical schools have really advanced. I have a number of medical students that come in from Brown now to my office. And my last one that came in, it was interesting. She had a pin on that said, she, her. And I didn't really understand why she had that. So we entered into a conversation. And then I started to realize that, I was a little bit backward in not really my thinking, but my knowledge base. So we had a nice discussion. I then followed up, I talked to my teenage daughter a little bit about how persons her age, she's about 18 now, thought about this stuff too. And it's been a really interesting educational process. And I thought, God, there's so many people my age out there, 40, 50, and over,
My age
who
too.
really have no idea, what all this means, right? Because back then it was just a very different thought process as to, what gender meant. So I thought it would be a great podcast to talk about it and educate. And that's why I came on and I said, I prefer the pronouns he, him. And maybe you can talk a little bit about that too, and why that's important.
Well, I'll talk about the beginning of what you said and then come back, and I wish I had worn my he, him pin today too, but I forgot it. And the context for this that I really want to say to people is to always keep in your thinking that we're talking about different ways to understand gender and sexuality, but all the things we're talking about have always existed. Nothing is different. People are people, and people have been all over the gender and sexuality spectrum from the beginning of time. And I can
This
speak
hasn't
to that
changed.
later.
It's just terminology.
How we're talking about it, how we understand it, and how people understand themselves are what's changed. So some of you might have seen on the flyer that was designed about the gingerbread person. The genderbread person. And you can Google that, and there's many, many versions of it. But I think it's a great way to understand things. So kind of the four, some use 6 ways. I'm going to use 4 ways to keep it simple. So one is gender identity. So, how I understand my gender. So let's do some terms first of all. Cisgender. So cisgender means that the gender I was assigned at birth, the gender that people have always raised me as.
And cis is spelled
CIS.
CIS.
So
okay.
I think it's Latin and it means same.
Okay.
And so cis is the gender I was raised in, is the gender I still identify with. So I'm a cisgender man. I was raised male. I still think of myself as male. And cisgender man, cisgender woman. Then there's, in the middle, is what we call non-binary. So people who, in some way, don't think of themselves as one gender only. So either that perhaps they alternate, perhaps they think of themselves in the middle. But I have several clients talk about that a label just doesn't feel right to their identity, that there's something in the middle. And then trans people, and now we use the term transgender rather than transsexual, partly to take that it isn't about sex at all, actually. It's really about gender. But these are
an interesting
people,
comment, right? Because I remember it was more called transsexual in the past.
Right, and it was, no offense to our medical staff here, but it was a more medical term. Again,
Correct.
People wanted a more human term. And also, it is about gender. It isn't about their sexuality. So transgender people generally are seeking to make a change from the gender they were assigned at birth. So that's gender. That's how we understand. We all fall somewhere in that spectrum, all of us. Now, the next thing is a little more subtle, gender expression. So feminine, masculine, and then somewhere in the middle, again. And if we really think about this, the concepts are new, but we've all known people like this all of our lives. People that identify as more feminine, identify as more masculine, identify in the middle. That's always been true. Any of you who've watched the new Queer Eye show, Jonathan Van Nuys is a really good example of that. Beard, long hair, skirt, and high heels. Yep. And he talks about that. And a little aside on that, I was talking to a gay male friend about that and saying, gay people who define as gay have often had similar issues about gender that, straight people do. Like, what is this? What does this mean? I don't understand. People were either gay or straight. Now, what are they?
So it's not just heterosexuals have difficulty understanding this terminology.
Not at all. And, Chris was mentioning age. I see a lot of middle-aged gay men because I am a middle-aged gay man, and I hear it all the time. Like, what is this? This was not like this when I was younger. The truth is it was, but people didn't talk about it. So, gay men who were more effeminate. So Jonathan Van Nuys, for example, identifying as both gay and non-binary is kind of making a statement that identifying as non-binary is as important to his identity as being gay. It isn't just about who he sleeps with. One thing I was saying to Chris when we were talking the other day, one of the old chestnuts about this is that gender is who I go to bed as, and sexuality is who I go to bed with.
I think that's
That's
great to
that's an
clear it
awesome
up.
way
That
to
yeah,
that's great.
yeah, it helped me in my mind because all this was new to me, and I think now, with the complexity of gender that we're seeing,
Yeah.
I think every family is touched by it in some
Right.
way, and it does
Yep.
get confusing.
I had the toughest time trying to understand the whole binary, non-binary concept. And my daughter was explaining that to me. And I think the way you explain it, basically what you just said, that statement makes a lot of sense. And it clarifies some of this, that understanding gender is different than, who we have sex with per se.
Right. And they really are completely different. I can tell you this as a clinician, that that the trans and non-binary clients I see have all different sexual orientations. There isn't necessarily their choice of partner has nothing to do with their choice
So
of gender.
remind the audience again what non-binary means, because
Yep.
this is a topic I think it's very hard for people to understand.
So non-binary are people who don't strongly identify with either being male or female, or somewhere on that spectrum. I think Jonathan Van Eyes knows that he's sort of masculine in some way, but he's also feminine in some way. So that's where non-binary. And a lot of celebrities are beginning to come out this way. A lot of people, and I think it's again more common than we think. And I hope that me reminding people that this is not new, but just naming it and putting something around it. Is what's new, and one thing I also want to say is it's not neutral, and that's one of the things that I hope I can weave through this as well, is when you don't identify as male or female, there can be vast consequences for employment, for discrimination, and we've often given permission. I remember, and I can say this as a gay man, that, well, why, I'm gay, but I don't have to be feminine. I mean, why do you have to be feminine? Not really understanding that it isn't, there was this whole idea that people were putting on a show, or the same thing for lesbian women. Well, I like women, but why do you have to be butch? Can't you just be? And it's that misunderstanding, that idea, and it is sort of in a way, this model that the right way to be is to be on one of those poles. And if you're in the middle, something's wrong with you. And honestly, as I said, this has existed from the beginning of time. This is not new. But talking about it, thinking about it, is new. I want to go down, and I'll try to do this quickly, to the other two categories. Biological sex, whatever that means. But so, genitals really is what we're talking about. So female genitalia, male genitalia, and then intersex. People whose genitalia, I remember the stereotype when I used that word hermaphrodite, which again I said is not really a good word to use, but I remember as a kid my thought was, well, gee, they have all the male and all the female organs. And I think anyone who's been in the medical profession knows that actually is not what really happens.
Correct.
Is that there's more of an ambiguity in some way, an enlarged clitoris or a vaginal opening and a penis, but one much smaller than, and so on. So the reason I want to bring that up, partly, the big thing, this is a justice issue a bit, is surgery. So when I was a kid, and I remember this, there was a big thing like, okay, let's look at the genitals, figure out what's more, and then let's make a surgery and have the person be more that other gender and raise them that way.
Well, that can be really devastating.
Devastating.
If you're guessing what someone will want to be when they're older,
Right.
and I never really thought about this because I really don't see patients in this situation. But let's say someone is intersex and has basically both genitalia, or to some extent, and a parent or a guardian makes a decision, and then 16 years later, the person
Right.
realizes that decision was the wrong decision. You must see patients like that. It must be devastating.
Yeah, it is. And surgery is not a neutral thing. It does harm. So sometimes you damage nerve endings,
Right.
the ability for pleasure. There's a lot of people who their genital, quote unquote, female genitalia were reduced or changed, so then their ability for orgasm can be destroyed. So really, I'm going a little on a side for this because I really want to advocate for. I understand why you would have a child with this and pick a gender to raise the child. I think in our society, it's increasingly getting easier to not, but I think, I can understand why you might pick to raise, but I would say don't make a surgical intervention or a medical
Right.
intervention until a child is older and let
Yeah.
them decide how to do that.
Well, it's hard for me to really be critical because I'm not in that situation as a parent, but I'm thinking that it's all well intended, right? They're probably
Yes,
thinking
yes.
they're thinking that boy, this kid is going to be really abused in school or whatnot, and it's going to be very difficult socially for them to adapt. So they make that decision. But things are much more open now.
Right.
So there probably isn't that urgency to go forward and have a surgery.
Can I follow up on something else too
Yep.
that you said? You said, the child can decide when they're older. So what is that age? Because sometimes,
Yeah, that's a great point.
You know,
Great topic. So I used to work at Fenway Health in Boston, which is an LGBT center in Boston, and worked with a lot of different patients. And there's a large controversy, and we're definitely not going to solve it in the podcast here today.
Oh, come on.
But about, at what age, when a kid begins to, express that I'm not the gender that you've said I am.
Right.
What do you do? Do you allow them to go on hormone blockers? And I guess just as a piece of information, I think people are so afraid that you will damage a child forever if you give them hormone blockers. And the medical reality is kind of the opposite. That if you put someone on hormone blockers and they change their mind and you take them off hormone blockers, they will go through normal puberty. But if they are really having distress, the rates of suicide among trans and non-binary people are astronomical. I looked it up before I came on, and HRC, the Human Rights Campaign Fund, in 2018 said that 29.9% of all transgender people had tried to kill themselves.
That's sad.
That's
terrible.
huge.
that's big.
And puberty is a time for that, when you really begin to see your body, isn't what you want it to be, and all of a sudden you get this rush of hormones that makes it even less what you want to be.
Right.
So the blockers really buy time. They let people have some time to decide. And from a practical point of view, if you are trans and you go on blockers and later you decide to have surgery, it makes the surgery much, much better, more effective. So
that was a standard practice up at the Fenway. Would they use hormone blockers? Yeah.
We only began seeing kids. I don't want to speak for Fenway, so and I'm not there anymore. But I think that's the understanding now with counseling. You want parents to meet and talk about this, and every family has to make its own decision. But I think knowing that this, I think the fear is that you're going to do something to the kid that is irreparable. What if they change their mind? And I think that's the education piece, is they can change their mind.
I guess you just answered my next question, because as a parent, I would be like, are they going to outgrow this? Is this just like trending right now? Like, how do I know when, to take it to that next step? But I guess counseling is a good way to start.
And it's a big topic. And, the politically correct defensive answer is, just listen to the kid and do what they want. The reality is somewhat more nuanced, that people do change their mind. They do think about that. And I don't, it's a horrible burden on a child to say, you have to pick this and you have to be sure, and that's it.
Well, I just remember the decisions I made when I was 17 or 16 are not the same decisions I would make now. And, is it like you just have that innate belief and feeling that has to come through, that child just knows?
What you want to do is help the kid explore. And, I think of things, one story, I sometimes tell clients this too, letting kids, like little things like toys. Like if your boy wants an Easy Bake Oven, buy them an Easy Bake Oven and don't lose your mind. And because we find our way. So when I was a kid, I had G.I. Joes, like a lot of boys my age, and I had the headquarters and the whole bit, and a couple of guns and all that. But I made fitted sheets for his cot that tucked under. And that's what we do.
Yeah.
Your sexuality, your gender finds a way.
Yeah,
So if you as a parent can just say, what do you want? And let the kid explore. Support the kid in their journey around understanding who they are. And not locking them in either way, quite frankly. But just, hey, it's okay to talk about this.
But
Hey,
it really is a journey, isn't it, for some people? Right?
Always. For everybody, honestly.
Yeah.
A short journey for some people, a long journey, a more sure one. I've met people who were very sure, like some of my transgender clients, that they, wanted to be a different gender. Then other people in between. It's always a journey. And the last thing on the genderbread person, and then I'll be quiet, you guys ask me more, is about
This is great.
sexual orientation. So explain a few terms. So heterosexual, I think most of us know the meaning of that. Bisexual, we know the meaning of that. And then at the other end, homosexual, people who have attraction to the same sex. And right after bisexual, there's a term many people have heard. And if anybody watched Schitt's Creek, David defines himself
Great
as
character.
pansexual.
Okay.
Right? So what is that? What is pansexual? And it is related to bisexuality, but again, talking about bi being binary, I like men and women. Pansexuals mean I like a wide variety of people. So I might like a trans person. I might like someone who's non-binary. I might like there's a great scene in Schitt's Creek where he's talking to his friend and they're talking about wine and they're using wine as a metaphor. And he's like, sometimes I like a red, sometimes I like a rosé, sometimes I like a white, sometimes I like a rosé that used to be a white. And it's this really wonderful, funny, but telling way. There's a similar scene in an old movie, Spartacus, if some of you have seen it. It was actually deleted from the original Spartacus, but you can get it everywhere online. With Tony Curtis and Laurence Olivier. And they're actually talking about sexuality, but similar thing. They're talking about liking different foods. And the Laurence Olivier character is sort of flirting and saying, well, I like a wide variety, and goes into this whole thing. So again, something that always existed, right? We're now talking about things that were always there. And we're empowering people to explore and own parts of themselves before we're there, but sometimes we shut them up. Okay.
Oh, that's great. Thank you. Yeah, I love it.
So when you have a variety of clients that come and see you, what are some of their biggest challenges?
I mean, honestly, a lot of it does come from their families and their worlds being understood. So the pronouns that we talked about a little bit.
So that's what this is all really about,
right?
You know, so.
And I don't think most of my clients are intolerant of people not quite getting it or not understanding or making mistakes. It's I have several clients whose families refuse to try, or I raised you as a girl, so you are a girl. I had one sweet client I was talking to not long ago about their grandmother, and how and my client saying, I don't expect that she will change her pronouns, but she's not oppressing me, like we still have an interaction. She sees I have a mustache now. She sees, or one of the books, if we get some time, I recommend, and I learn a lot. And Chris and I were talking about stories. A lot of biographies of trans people are really great ways to know. And there's a book called Becoming a Man by P. Carl, and he talks about that, about his family and the real pain around getting them to recognize who he is. So I think people can mostly be patient. But it is about that, are you listening? Are you asking? Are you willing to engage me in a discussion? Or, because I think what's insulting sometimes is the thought that this is a debate. Like, what my gender is something you think you can debate? Like, that doesn't make sense, at one level. So, and I think, coming back to your parents, I get also that it's hard for parents to think that I had this assumption about my child,
right,
and you're telling me it's different. And I get the pain in that. I think, but we can go too far with that. Like when people say when someone's trans, they've lost their child. It's just not true. You have to change how you think about your child. And from the child's perspective, I can say as a therapist, they're saying, I'm now me, and I never was me before. And the parent's perspective is, well, I knew you, now you're something different. Mm-hmm. And can we sit with that tension a little bit?
So there has to be a lot more support out in the general communities now than there was before. You said this always existed, but now that it just seems more open and people are willing to explore more openly now. So can you talk about some of the community supports, like someone that...
Oh, yes, I made a little notes. So yeah, there definitely is more, and I think the internet has exploded everything.
Yeah.
That now if you're in an area where there isn't a lot of support, you can find virtual support. Some stuff that I'd mentioned sort of in New England, Massachusetts, southeastern Mass areas that I have. So there is Fenway Health, where I worked, has a specific trans health division. So you can call them for resources. And actually there is a Fall River, and you can find this when you look. Fenway has a violence recovery program, which is geared toward domestic violence in LGBTQIA communities. But they will expand beyond that. So you could contact them. Jeff Glidden is the therapist. I've talked to him about this already. And even if his specific work isn't for you, he'll help you find those resources. I found out that Rhode Island has an LGBT center that's on Facebook. It looks like it's more virtual than anything else, but that's still a resource. There's a wonderful group called Compass that is based in Boston, but they're also, again, doing, with pandemic and so on, Zoom. And Compass is a peer-run organization for people on the trans-masculine spectrum. And let me back up at what that says, but it's people who, and actually, this is a good time to maybe talk about what a trans man and a trans woman is.
I was going to
Yeah.
ask you
Yeah.
about that because it's very confusing
Yes.
for some people.
So well, let me start there then.
Sure.
So when you're referring to someone as a transgender woman, let's use that, then that woman part is the gender that they embody. That is who they are. So when I say transgender woman, this is someone who presents female, who lives as female, regardless of how they were born or raised. When I say transgender male, same thing, that this person is male. This person identifies as male.
Right. So it doesn't mean they've gone through surgery or had any physical changes necessarily, although they may have. It just means they identify. So
Right.
they could have been born physically male, but identify as a woman and identify as a transgender woman, even though they still have male
Right.
anatomy. Correct?
And yes, and to talk about that too. So again, people kind of resisting this binary. They think, okay, once you've had the surgery, then you're the other thing, but before that, you're something else. The thing is, it's not so easy. Like when I talked about intersex people, it tells you how genitals don't always tell you everything. So, and there are a variety of surgeries. So people have different surgeries at different times. And I think it's, if you think about it, really odd that we say, well, once you have done this, then you have made the transition. Right. Because it's a process, hormones, surgery, and people make different decisions for a variety of reasons. So transgender men, for example, not every transgender man decides to have a penis, to get a penis. And part of that is personal choice, but part of it is also the surgical techniques are still not fantastic, honestly. Some of them are better than others. It's gotten better, but so if you're going to change your body that radically and the results are not going to be great, why would you do that?
Right.
Yeah.
And I think now there are people, it used to be you'll never find anybody. And let me tell you, that's not true. There is somebody for everybody. There is someone who is attracted. So the decisions that people make around their surgeries are complicated. I'll tell you a quick story. A friend of mine who is a transgender minister, and he was giving this great sermon, and he is a trans man, was raised female as a trans man. And a lot of these people, trans men, when they go through hormone therapy, their look, when they walk down the street, you would have no clue this person had ever been female. I mean, they look like short men most of the time. So he gave this great speech on being transgender, and a lot of people didn't get it, like, what you were saying. So one person came up to him and said, oh, don't worry, once you get your hormones, that'll get rid of your beard. Not understanding that he had worked so hard to get the beard by being on hormones.
I got it.
But the best thing he said was someone questioned him after his sermon about his genitals. And he turned to them and he said, do you ask everybody who preaches at your church what their genitals are? And I thought that was the best question. Like, why is it important that you know? That has more to do with you than the person. I mean, if you're going to have sex or have a relationship with someone, okay, I get that you need to have a discussion about it. But other than that, if someone is your grocery store clerk or someone is fixing your car, why do you need to know their genitals? Why is that an important question?
Correct,
So, So Compass, I was saying before, is an organization for people on that trans-masculine spectrum. It's peer-run, wonderful organization. And they share things about surgeons and things like that and so on.
So am I right in understanding that when we think about gender, it's not really what's below the belt, it's what is in here, right? It's like what we think we are, so to speak. Is that correct?
Yeah, I would say, how we identify, how we understand. And I know some people have a hard time wrapping their head around that. But again, I want to come back to this is not new. There have always been people that have just not quite fit into those categories.
Right.
And one thing a lot of people have done is, quote unquote, round it up. Like, okay, I know you're going to think that, so I'll just let you think that. Now we're saying, okay, maybe that's true, but could we also back up a little bit? And what if I don't do that? What if I, what if I did that? What if, again, example I'm most familiar with is a lot of gay men who, quote unquote, are very effeminate. And some of them are now identifying as non-binary or somewhere on that spectrum, realizing that it isn't just who they sleep with that's part of their identity. and they're not putting an act on. This is who I am, and wow, maybe that's just as important as who I sleep with. And the same thing for women. There's a wonderful book. It's an old book, and it was before some of these terms that we use now, called Stone Butch Blues. It's a woman, Leslie Feinberg, who, a trans person. They've passed now, and you can see I'm struggling as well as we all do. But they wrote about what it was like to be very, very butch. And what would happen with that? Getting jobs, getting understood, we have traditionally given ourselves a lot of permission to be violent or upset at people that betray the gender norms. If you look like you're a little bit this and a little bit that, well then you're acting. So I have permission to hurt you, to discriminate against you, to do all that.
Yeah, that's a great point. I mean, there's been a lot of violence against persons who don't fit into a category that society says they should fit into. So, and that goes beyond even gender.
Yep.
I mean, we see that in race, whatever it may be, right? There's always a lot of that out there, and it's unfortunate. But I mean, that's really a big part of this, isn't it? I mean, if you look at the trans community, you mentioned about the percentage that commit suicide, but I also know that there's a great deal that are victims of murder and violent assault and whatnot. There's almost a sense that there's this sense by some persons that that's okay to do that to these people because they're less than.
They're not human.
They're
There's
not
something.
human. I didn't want to say it because it was kind of painful to say, but that's how people look at it sometimes.
I think too, if you knock that down a level, not maybe to when you get violent or anything, but I don't think society is comfortable with unknowns. Like, we like to categorize things, and we like to put things in certain buckets.
Right.
You know,
You want
when
everything
you
to be in a clear box.
And when you can't do that, and you don't understand it, then you're overwhelmed, or you just try to ignore stuff, or you don't know what's polite to ask or not, and you shy away.
But we talked about this earlier in another way. We were, before this, we were chatting a little bit about how society has changed, and everything used to be very black and white, and there was a path, right? There was a path that everyone went on. So, you grew up, you went to school, you got a job, you got married, you got a house, you had children, and that was the path that everyone did in our generation, right? But it's different now, right? There's lots of paths that people can go on, and that's not wrong.
No,
but where
it
things
can be
used to be black and
confusing.
white, there's a lot of gray now, right?
So, but let me, again, saying how not new this is. I understand what you're saying and why you're saying it.
I know
and
it's
I grew
not
up
new.
that
I'm
way.
just saying society is.
Well, and that's what I want to address, is that those
but
of us.
It is new in a way, not new to the people that are experiencing it, but to the people that are in the norm, I guess.
Well, that's the point.
I don't know if I said that, if it came out
Well,
the way I
look,
wanted
we've
it
got to have
but-
permission to be awkward. So
Yeah, it
don't
is
worry
awkward.
about
It's an
that.
awkward.
We've got to have.
Sometimes it's
But-
awkward to have
because
this.
we won't
You know,
learn
because
if we-
I
That's
never,
okay.
10 years ago, I never knew any of this stuff. So it's new for me.
Yep.
Right.
But that's the point in a way. Like what Chris was saying is true. Like when we look like the way history is being understood now. Like say, and this is now departing from this stuff, but Thomas Jefferson, for example, we have this whole set of who Thomas Jefferson was. Now, when we understand Sally Hemings, this African American woman who we had a relationship with and children with, and so on, it's another picture. And there are people upset about that. Like, I don't want to hear about that. I don't want to know about that. And I think the same is in this case, that, those of us who were raised the same as, so me as a gay man was raised in the same world as you were, but I always knew I was apart. I always knew it was different. If people have seen Mad Men, there's a gay character in there, and you can kind of see the torture, or Boys in the Band, that was a movie that just got remade, and you get this glimpse of this little gay male culture that existed at the same time other stuff was happening in the 60s, but was a completely different world. So I think what's happening is the internet, our world, we're all of a sudden getting a bigger picture. And I think that's freaking people out, is like, but it was this. And I'm like, well, it really wasn't. That was one sliver of the truth. And I'm not putting it down or saying it's bad, but this is really about expanding. That's what I
So
was
it's not really, so, I mean, you're both right? I mean, it's
Yeah.
not that it's a new concept. This was always out there, but there was a great deal of the population, like Nancy and I and many, who just didn't understand it. So it's new to us.
Right.
Right. So
Talking
it's-
about it is new.
Right.
Bringing this stuff up is new. Like Thomas Jefferson or, a lot of historical things that we didn't know about before. Tulsa, the massacre of
Sure.
African Americans in Tulsa. I mean, I didn't have that when I was in history in
We
high
didn't
school.
learn that.
Right.
I mean, basically, history, when I went to school it was, we got up to about Christopher Columbus, and I think that was every year we'd repeat the same thing.
Right.
I think we might have gotten to World War one or two times, but we never really went past that. And the history we learned was very, very limited and probably very not correct in many ways.
Well, and so another book that I put on my list is a book called Biological Exuberance, and it's
Yeah.
this biologist that talks about sexual behavior in animals and gender behavior in animals. And it's interesting because one of the arguments that kept being used against trans and people who are not straight, so to speak, was it's not natural.
Mm-hmm.
Well, this biologist went, well, this is actually what happens. And what really gets uncovered is scientists, when they were looking at animals, looked at mating behavior and thought of anything else happening as just this aberration that gets in the way. And when someone said, well, why don't we look at that? Then the whole world opens up. You understand a whole different reality.
So, Chris, when you're with your clients and stuff, is there like a common theme with stigma and something like a message that we can get out
Yeah,
to increase sensitivity?
And again, I want to be clear. Making mistakes is what happens, and most of my clients understand that. What they want is the intention. Are you listening? Are you trying? So trying to respect people's pronouns. And names are a big thing for a lot of people too. That, if you feel like you're not the gender you were raised as, then a name that's very gendered
Right.
has never felt right. And all of a sudden when you take a new name, that's an amazing thing that finally feels right. So
It's probably liberating.
right. It's
Yeah.
like, here's me.
Right,
Here is
okay.
me. And people view it a new thing, but to the person, I'm finally letting you meet me versus I'm showing you this new person.
That's a great way to put
Yeah.
it.
So
I love that.
honoring the name, trying to honor the pronouns, ask questions, but going back to the story I told about the minister with the genitals.
Don't ask about their genitals.
Right. And try to resist. Asking questions is good, but don't treat the person as an object or a novelty. And
Yeah,
remember that
okay.
people are more than their gender. That, ask people what they do for work. Ask people what their hobbies are, It's okay to ask about gender, but listen. And if I had to say anything, the big thing is listen. Tell me. I don't know. Tell me.
Yeah, I'm
That's
sure
what
that
I'd say.
some people would appreciate that, right?
A lot.
Yeah.
We all want to be heard.
Yeah.
Now, when you the supports that you listed in the resources,
Yeah, got a
is
few
there?
more.
Oh, I was gonna just ask, is there one out there for like parents of someone going through a journey?
Yeah, so I would say, and this is a very good recommendation. This is a nationwide organization, very powerful, very well done. PFLAG, Parents and Friends of Gays and Lesbians, but also now trans people and so on. And they are a network and an organization worldwide that is for parents of children who are somewhere on the sexuality and gender spectrum. And they do phenomenal work. And it can be really good for parents to talk to other parents.
Oh, sure.
Because there's a great dialogue in people talking across communities, but also in I do this with when I talk to gay men about transgender issues. Like there's something when they hear it from me that's a little different. So, so PFLAG I cannot recommend enough. Super healthy, super big, lots of resources. I highly recommend PFLAG.
And just so everyone knows, we'll put out all these resources as a link to on all our social media
Great.
sites.
You know what I found interesting you mentioned, and I didn't know this before. I mean, I always assumed that gay men would have like a deep understanding of all this, and then the way you brought it up, it's they're kind of in the same situation as many heterosexual people out there, right?
Completely. I see, again, a lot of middle-aged gay men because they want to see a middle-aged gay man. And they are as flummoxed as other people. And I think, and there's also another thing that I think other people relate to too, that you've alluded to. They felt really comfortable. Like I found out who I am. I'm gay. That's good. gay marriage, equal marriage happened, all this stuff is great. Now, wait a minute, you're telling me now it's more complicated than that? And I have to think of people more differently. I just became gay, and not became gay, but you know what I mean? I owned my identity. I got this whole thing. And now...
Came to terms, or whatever you want to say. Right.
And I have to think when I date about somebody's gender, even if they look like men, and, people getting really angry. Or I'll tell you a sad story from someone that I know. Well, it's not really sad. They're doing pretty well. But a male couple, one is a cisgender man, one is a transgender man. So they're a gay couple. And a lot of people don't know that the transgender gay man is a gay man. It was assigned female at birth, because most people don't actually. But when people find out, a lot of people say to his partner, "Well, you're not really gay if you're dating someone that doesn't have a penis," and that's just a very strange thing. That's just they are two men. You saw them walking down the street.
Right.
They face all kinds of things.
So the one person, and we're not supposed to ask these questions, I guess I would never ask this personally, but did not have surgery, so had female...
Has had most surgeries, but has not had
so
genital
had top surgery,
right.
not bottom.
Right.
That's actually a term we should talk about,
Yep.
right?
Yep.
Okay.
Top surgery is, so as it might sound, above the waist. So for trans men, it's usually chest reconstruction. So mastectomy and then a reconstruction of a male chest. And for trans female people, breast augmentation. Because hormones do affect this a bit, but in a lot of cases, not dramatically. So surgical intervention is necessary. But yeah, the trans person in this couple is male, 100% of the time at work, in life, and takes testosterone, and is a hairy, muscular guy. But when people find out that oh, you don't have a penis, well then your partner must be straight, and that's not that's the nuance.
But you can see how that can be very confusing to people. It's really...
To gay men as well, and I guess that's where I went to that. The gay men's like, what? But is that the most important thing about being gay? Is the penis? We could go on about that, but it's more complicated. And this person, who is with a trans man, doesn't date women, has never dated women, is not interested in women.
Right.
So you don't know what people's real story is ever.
Right.
And
I
be
guess
honored
you
if
don't
they share
have
it to you.
to. Is
That's
the message, it's just like, let them be.
Yeah, you're right. It's really not our business if they've had bottom surgery or not.
Right.
Right? That's so true.
Right. It's a need to know thing.
Right.
There are times where I do need to know someone's genitals, but like I said, not the grocery store clerk, not the postal delivery person, not the firefighter. Why do I need to know? If you're saving my house, I don't care what your genitals are.
Right. That's a great
Chris,
point.
is it all out-of-pocket expense when you do the hormone therapies and the surgeries?
Well, I will say that thankfully, since we are in Massachusetts has been absolutely wonderful about this in most cases, and has expanded this even more. But the thing to realize is that is not true around the country and around the world. And that is a very big, big issue. There are scholarship funds and fundraisers, especially, and it could be a whole other topic, internationally. We're in the United States and we're in the Northeast. And when you're in the Northeast or you're on the West Coast, we're in these little bubbles. But you go to other parts, getting surgery, or the other thing I did want to say about medical treatment. So trans men, who will go through stages, take hormones, maybe will have a hysterectomy, maybe won't, but will be in a different stage, have to continually get the same care that a cis woman would, have to have gynecological exams and so on. And that takes a great deal of sensitivity because there can be a lot of issues with the person, but it is essential to health. There's a documentary, and I meant to look it up and I can't remember the name, but about a trans man who ended up dying of uterine cancer, or was it ovarian cancer, but one of those, because no one would treat him. They wouldn't give him, he was in a rural part of the country and couldn't get a doctor to treat him. And died.
Just to do a pelvic exam.
Right.
That's sad, actually. Very
so
sad.
the health issues are, And if people do have general surgery, there's also generally some post-surgical things, and I won't get into details, but that also have to be followed and maintained over time. So,
Can I ask you a question that I don't know if you're going to have the answer to this or not?
Chris has
But-
all the answers.
I have all the answers.
But so, are other countries like further ahead than America is with their thinking
That's a great
and their?
Can I guess?
Yeah.
I'm guessing Europe's pretty, they're pretty good with this stuff, but I'm thinking other parts of the world, maybe I'm wrong, like Asia, and that is not.
Russia. probably.
It depends. It really goes country by country. So, and there are also countries that deal with this don't have some of the gender baggage that we do.
Okay.
So, for example, like Thailand and Vietnam, there's always been this kind of role for androgynous men. So, a lot of Americans actually go to those countries to get surgery because it is cheaper.
Right.
And so on. So, and then in countries like Norway, Sweden, there's been a long history around surgery and so on. So,
Okay, I didn't know that. That's fascinating.
and then Western Europe, somewhere in the middle, depending on the country, but yeah, often better than us. And then in the Middle East and in Africa, very, very, very difficult. Really,
I'm sure it's terrible over there.
and people die often.
I mean, they're still doing clitorectomies in some
Right.
countries in Africa, and just really, just scarring for life, young girls.
And I'm glad you said that because, one of the terms we hear sometimes is female circumcision. Again, a whole other topic. It's not circumcision. It's
No,
mutilation.
it's
You're destroying part of someone's anatomy because, and really the purpose is even, really awful.
Horrible. It's really
because
horrible.
a woman is not supposed to feel too much pleasure. So, so that's a whole other thing that's just really criminal.
Chris, can you tell us about a story on one of your clients that, talk through their journey and, this maybe some struggles or some challenges, but maybe someone that had a really positive outcome from where they started?
I'll composite it a little bit because I
Okay.
definitely don't want, but
Sure.
I remember a client, I'll call Ben. And Ben came to me at the beginning of Ben's transition from female assigned at birth to male. And I saw him through the whole thing. And the whole thing means at the end identifying as male. And had top surgery, hormones, voice deepened, grew a beard, the whole thing. As a clinician, what I want to say, and I've seen this over and over again, came to me with depression, anxiety, mood swings, and so on, and homelessness. This story can go on and on. But in the end, after the interventions, was a completely different person standing in front of me. And mood symptoms had changed dramatically. And that's not just hormones. I think finally coming to that conclusion. So when we terminated, it was a very different person, than the person that I had originally seen. And I watched it happen. I watched his joy when his voice deepened. I watched him coming in and telling me about shaving for the first time. And what I would also say, again, coming back to these stories, I'll do a quick. I think that's a great way to find out things is to read biographies. So let me just give a couple of notions for people. She's Not There, A Life in Two... And I guess you will put these up, but I'll just say it quickly. Jennifer Finley Boylan, who was a college professor, still is, and is someone who is trans, is married to a woman, and is still married to a woman. Defining Realness and Surpassing Certainty. Those are two books by Janet Mock. Some of you might know was part of the creation of the show Pose, about her journey as a transgender person. Stone Butch Blues, Leslie Feinberg I mentioned, and Becoming a Man, a Story of Transition by P. Carl. So I think there's something when you read these stories that makes it difficult for you to dehumanize people when you read their stories. So I, at least for me, there's lots of educational books too, and I have some of those down here, but for me, when as a therapist, stories are what I'm all about. And I learn a great deal when someone honors me with telling me their story. So...
Yeah, it really is a really privileged position we're in as clinicians to hear these stories and to have people open up to us about really their deepest concerns. We sometimes can forget how privileged we are, but I think about that often. especially when you have a situation where someone comes forward with something as important as this, struggles that they've had for many years and whatnot.
Chris, as we begin to wrap up, can you just let us know how to get in contact with you if someone wants to reach out to you and continue this conversation?
Sure. I am at a collective practice that is focused around the LGBT community called The Meeting Point, Jamaica Plain, and there's information about me and other clinicians that I work with. You can also reach me at chrismedeirouscounseling@gmail.com. That's probably the best way to get me, is to email me. I do have a website, chrismedeirouscounseling.com, which is in need of update, so don't judge me. And I hope to be doing some more stuff, some group therapy at some point. And now also the beauty of, one of the things that pandemic opened up for a lot of us is Zoom and virtual therapy. So a large part of so now I see people in Massachusetts who are not in the Boston area and may never come to my office, or the thing I'm kind of negotiating now is to have someone come in maybe once or twice so that we meet, but then we will do it on Zoom. And across state gets to be more tricky because of licensing and so on. But most therapists I know are in the same position. We're in a hybrid, so I see people a day and a half in the office, and then the other days of the week I see them on Zoom. So there's a lot of ways to talk to people. But I think support groups like Compass are also really good. PFLAG for people who are not. I think that's a great way to kind of begin this journey. I'm trying to think if there were any other. Well, you asked about me, but I have other resources as well. But anyway.
That's great, thank you.
And then, is there one message you definitely want to leave with our listeners?
Listen, ask. I don't know. Tell me who you are. Humility. I don't know this stuff, but I want to know you. I think that makes it. And also understand some things that you want to be true are not always true. One of the things, this is a little bit beyond just talking about gender, but I grew up and probably with this value of family and parents. You have to value them. And I have to tell you, some of the clients I see, their families were really not good and healthy places. And it isn't always the best thing for them to reconcile. Sometimes it is, and I want to explore that with people. But don't assume that that's the healthiest thing, because sometimes it really, especially, it's another thing that I do. I work with people a lot around spirituality and religion, both as a positive force, as a way to energize them and give them, but also for people who are really damaged by being in very kind of conservative, discriminating groups that really harm them tremendously. So don't assume sort of the things that might make you feel good, your family, your church, don't always work for people who've been pushed out of those institutions.
That's great. Great advice. Thank you very much. This was a really fabulous conversation. I love it because, usually when we have people on, I have some deep knowledge of what we're talking about. And this is one where I really learned a lot. And it was great because, this is stuff that I needed to learn. And I really learned a lot from you today, and I really appreciate it. So
I know.
Thank you.
I felt like I just wanted to listen. I didn't even want to ask you any questions.
we could go on for hours, but I'm sure that, for me, what my takeaway message on this is, be open-minded and don't put people into boxes and be respectful. And that's probably what we should always be.
Well, and for the professionals, clinicians in your audience, consult, talk to people, go to someone who has more experience than you and ask them. That's also a big message for me, is work with people. I don't know. Do you know? Can I ask you? And not always make it on the person. If you have a trans or a non-binary person you're seeing, ask them questions, but also when you leave them in the office, go call somebody who knows a little bit more and say, hey, don't know what to do. What should I do?
Right. We need to have some humility and realize that we can't know everything about everything and go to someone sometimes who is more expert in a particular field. But thank you. This was great. I really appreciate it. I want to thank you so much, and I'm sure that our viewers really enjoyed this very much. And we'll post all of this information on the site so that if there are those out there who are interested in looking at some of these resources, they can get at it. I want to once again thank Bay Coast Bank. We really appreciate that you support these endeavors. And Bay Coast Bank, once again, is right for all of your financial needs. And you can visit them at baycoastbank.com or call 508-678-7641. So, Chris, thank you very much. It was great to see you
Thank you.
again and to talk about this and have this wonderful conversation. We appreciate it so much, and I'm sure we'll have you on again in the future.
I would love that anytime.
If there are questions that our viewers have out there, they can post them, and I'll send those along to you, and we'll get those answered.
Happy to help any way I can. It's really an honor to be invited back home to do this. So great.
Thank you.